Hello, everyone. Thank you for tuning in to today's webinar. This is the first webinar in a series for the Prevention Department at Mazzoni Center. Title of this presentation, Protecting Yourself Against COVID-19 While Living with HIV. My name is Kailah King. I am the Linkage Coordinator here at Mazzoni Center, and my pronouns are she, her, and hers. And today in this webinar, you'll learn what is COVID-19, what the medical and public health professionals are saying about HIV and COVID-19, tips for navigating your healthcare, what to do if you contract COVID-19, and also reputable sources to check for up-to-date information regarding HIV and COVID-19, not 10, sorry about that typo. So the purpose of this presentation, I think it's important for me to go over that with everyone tuning in today. Purpose, definitely dispel fear and misinformation regarding HIV and COVID-19, to address common questions regarding HIV and COVID-19, to provide accurate information regarding living with HIV during this COVID-19 pandemic, and then of course to provide you all with a toolbox to continue accessing accurate information. I do want to give this disclaimer. I am not a medical or legal professional. Some of you tuning in may have very specific questions. I have a slide at the end of this presentation that includes every source I used to inform the information included in this presentation. If at any time you're listening and you're interested in diving further into the literature or educating yourself, don't hesitate to reach out to me. You can reach me by phone or email or even text, and I can send the resource list to you. And I have my contact information at the end of this presentation, so don't worry. And then if you take away nothing else from this presentation, there are two things I want you to walk away with after hearing this. First, the sense of reassurance. If you're living with HIV during this pandemic, there are protocol and guidelines for you to protect yourself from contracting COVID-19. And of course, I'll go over that in the presentation. But if you're taking HIV medication and you've reached an undetectable status, we definitely want you to continue taking your meds and managing your HIV care to the best of your ability. If you are living with HIV, you can, and actually you have the right to, of course, access HIV and other medical care. If you need assistance with any of that, please don't hesitate to contact me, especially if you're living in Philadelphia or any of the surrounding counties. And then secondly, like I've mentioned already there, I'm here to provide you with reliable tools that you can use after this presentation to have access to correct information regarding HIV and COVID-19. So what is COVID-19? According to the World Health Organization, and of course that's a common question, according to the World Health Organization, coronaviruses are a large family of viruses that can cause illness in animals and humans. In humans, several coronaviruses are known to cause respiratory infections, ranging from the common cold to SARS, which, we dealt with that a few years ago. A common question that we hear is COVID-19 just like the flu? When people say that coronavirus is the flu or quote unquote a flu, that's incorrect. The flu is caused by the influenza virus, not the coronavirus. They're two separate viruses. I actually included a link at the end of this presentation from the CDC that explains exactly what the influenza virus is. So COVID-19 caused by coronavirus is the highly infectious disease or respiratory illness currently causing this pandemic. Coronavirus is a new disease, so it's caused by a novel or new coronavirus that hasn't been seen in the past. And actually, so we in layman's terms or in everyday speech, we refer to this newest coronavirus as COVID-19. And on February 11th of this year, the World Health Organization announced that abbreviation. And so for COVID-19, the CO stands for corona, VI for virus, and D for disease. And then the 19 is for the year that this newest strain of coronavirus was discovered, which was 2019. So another common question, of course, are people living with HIV at higher risk of contracting COVID-19? Now, this screenshot that's on the right-hand side of your screen I found that on the CDC's page for general frequently asked questions about COVID-19 in regards to who's at highest risk. The CDC definitely mentions that those who are immunocompromised, but goes even further to specify that while those living with HIV have the potential to be at higher risk, the specific language they use is those living with quote unquote poorly controlled HIV or AIDS. So again, in this screenshot, it says, people with a low CD4 cell count, and people who aren't on HIV treatment, whether with ART. So as far as we understand it now, people who are HIV positive and undetectable very well may have the same health risks with COVID-19 as someone who doesn't have HIV and doesn't have a compromised immune system. So of course, it would be best to strictly follow the CDC COVID-19 recommendations, and I'll go over those in the next slide. If for whatever reason you haven't or you can't achieve undetectable status, definitely talk to your healthcare provider who specializes in HIV for further guidance. And again, if you don't have an HIV specialized doctor, you need assistance with getting connected to an HIV specialized doctor, please reach out to me so I can help you find one and help link you to one. So what are the professionals saying about HIV and COVID-19? In this slide, I'll also talk about, again, like I mentioned a few moments ago, the recommendations from the CDC. So the screenshot on the left-hand side of the slide is from an email that I received. So I'm subscribed to the CDC's HIV, what's new from the Division of HIV and AIDS Prevention. And I received this email on April 17th. And in the specific email, they were recognizing National Transgender HIV Testing Day. But this screenshot that I've included right here, of course, briefly discussed COVID-19. And they're saying that although the risk of serious illness from COVID-19 for people with HIV is not known, people who are immunocompromised may be at higher risk. And again, this is just reiterating what I said in the last slide as far as, people with HIV should continue to take their medications daily, and they should, of course, also engage in the everyday preventive actions to help curb the spread of the virus. And then the CDC defines everyday preventive actions as cleaning your hands often, avoiding close contact with others, covering your mouth and nose with a mask or cloth when you're around others, covering your coughs and sneezes, and of course, cleaning and disinfecting on a regular basis. The Fenway Institute further suggests that people with HIV should also continue to maintain a healthy lifestyle. So this includes eating healthy, aiming for at least 8 hours of sleep, and then reducing stress as much as possible. Of course, these recommendations don't necessarily account for, or rather go into too much detail about addressing the socioeconomic factors that may prevent someone from achieving some of these things, such as quote unquote eating right or getting enough rest. But of course, at the end of the day, we want everyone to try to achieve these things to the best of their ability, especially during this time. If you notice, all these recommendations aren't any different from what the rest of the population is told to do as far as minimizing their risk of spreading or contracting COVID-19. And of course, I included sources at the end of the PowerPoint, which outline specific ways to perform each recommendation. So with intersectionality, I briefly wanted to touch on the intersectionality of LGBTQIA plus persons living with HIV during this pandemic. The Fenway Institute actually expressed particular concerns for people in the LGBTQ community during this time as it relates to COVID-19. LGBT older adults already experience higher rates of social isolation than straight and cisgender age peers. Social isolation will increase drastically, or has increased with this pandemic as individuals engage and continue to engage in social distancing. This can exacerbate underlying mental health issues and physical health issues as well. LGBTQIA plus persons may be more likely to work in the food service, restaurant, and entertainment sectors. As we all know, many of these businesses have suddenly closed because of COVID-19, and people are out of work. This could also exacerbate pre-existing, economic vulnerability for people in the LGBTQ community. People in this community are more likely to have chronic conditions such as cardiovascular disease, cancer, and HIV and AIDS. LGBT older adults experience higher rates of disability than heterosexual cisgender elders, and LGBT people are also more likely to smoke and vape and to use substances. And at the end of the day, all of these conditions and behaviors could increase the vulnerability of LGBTQIA plus folks if they're exposed to the coronavirus. So the concerns that that we have that LGBT people experience discrimination in accessing healthcare across the board. Of course, the hope and the expectation is that people in the LGBTQ community who fall ill with COVID-19 will be able to access testing and needed care. However, because of discrimination, many folks in the LGBTQIA community don't access routine preventive care and may be less likely to access a coronavirus test. If you are experiencing symptoms of COVID-19, please seek medical attention. And anyone who thinks that they've been discriminated against in healthcare because of their real or perceived sexual orientation or gender identity can contact Lambda Legal, the ACLU LGBT Rights Project, or GLAD, which is the GLBTQ Legal Advocates and Defenders. Links to all these organizations are included at the end of this presentation as well. So tips for navigating your healthcare. Another common question, or a couple of common questions that we're getting, can I still see my doctor regarding my HIV care during this time? Am I still able to get my medication? What happens if I'm running low on my medication? So according to the National Institutes of Health, or the NIH, persons living with HIV should maintain on hand at least a 30-day supply of their medications. Ideally, we would like to see folks with at least a 90-day supply, but like I said, at minimum a 30-day supply of medications. Talk to your pharmacists and or healthcare providers, see if mail order delivery is an option. And also consider delaying any medication switches until close follow-up and monitoring is possible. Most providers are using telehealth for majority of appointments, and they're using this as sort of a triage to work with patients. Your provider will determine whether or not any in-person HIV care visits are necessary during this time. The Mazzoni Center is actually following this protocol for all their medical and behavioral health services as well. Even for the prevention department that my position is under, myself as the linkage coordinator, Chet Carter, our PrEP and PEP navigator, and Brian Taylor, our CLEAR, one-on-one wellness counseling coordinator, we're all following the telehealth model. And then from Mazzoni Center, other services like our food bank, for example, they have things where it's like prepared bags waiting in the lobby for clients to come pick up. So at the end of the day, we're all working to minimize, direct contact and keep everyone safe, both the providers and clients or patients. Quick common question, are shortages of ART or PrEP expected? There are no shortages of HIV medications projected. I've actually included a few sources at the end of this presentation if you're interested in keeping up with the latest news from the Food and Drug Administration or the National Alliance of State and Territorial AIDS Directors. And then another common question, what if I need to recertify for Ryan White? At this time, of course, HIV patients can still certify or recertify for Ryan White. Normally the process is conducted in person. Usually you have to provide some sort of signature or complete other paperwork at your provider's office. HRSA's HIV/AIDS Bureau created a policy that supports and recommends flexibility with the certification and recertification process. Of course, so long as the process supports social distancing and keeps everyone safe. This includes conducting the certification and recertification processes electronically and through self-attestation, which may look different at each provider. Of course, if you're working with your doctor, you need to recertify or get meds or anything, be sure to ask your provider about their new protocol in light of COVID-19. And again, I've included a source at the end of these slides, which goes into detail about that new policy and the recommendations. So, common question, what do I do if I'm living with COVID-19? I'm sorry, if I'm living with HIV and contract COVID-19? The CDC states that if you're sick, to stay home except to get medical care, separate yourself from other people and pets in your home, monitor your symptoms, call ahead before visiting your doctor, wear cloth covering over your mouth and nose, cover your coughs and sneezes, clean your hands, don't share personal items, and clean all high traffic surfaces every day. If you're sick with COVID-19 or suspect that you are infected with the virus that causes COVID-19, you should definitely take these steps to help prevent the disease from spreading to people in your home and community. If you think you've been exposed to COVID-19 and develop a fever and symptoms such as cough or difficulty breathing, call your healthcare provider for medical advice, just like everyone else. Continue to take your HIV medications unless otherwise instructed by your doctor. At the end of this presentation, I've included a source that provides more explanation on what to do if you're sick, taking care of someone who's sick, and how to disinfect your home. And here I just have a slide here of this is like and not an article, a picture from the CDC that says what you can do if you're at higher risk of severe illness from COVID-19. And so you see on the left, are you at high risk for severe illness? And then tips on what you can do to help protect yourself from COVID-19. And then lastly, of course, reliable sources for COVID-19 and HIV information. The World Health Organization, Centers for Disease Control and Prevention, of course, tried and true, HIV.gov, the Ryan White and Global HIV/AIDS Programs page, and also the National Institutes of Health, aka the NIH. This list isn't, all inclusive. Again, I have sources at the end of these slides that again informed all the information I've included in this presentation today. But these that I've listed here are some of like the main hubs of information for COVID-19 and HIV. And here are these sources. Again, if you would like access to these sources or would like a copy of this list, don't hesitate to reach out to me. I can definitely send this list to you. And that is it. Again, my name is Kailah King. I'm the linkage coordinator at Mazzoni Center. If you have any other questions or concerns, again, if you would like access to that resource list, or if you need assistance with getting connected or reconnected to HIV care, please do not hesitate to reach out to me. That's my email, kking@mazzonicenter.org. That's also my telephone number that comes to me and only me. I only have access to it. You can call or text me, 267-817-8404. Thank you all for tuning into this webinar, and I look forward to presenting to you all soon.